I'm sure you guys have heard by now that Bronny James, LeBron James' son, suffered cardiac arrest during a workout with USC. He collapsed onto the court. He was then rushed to the hospital and has since been released from the ICU. He's in stable condition and will hopefully make a full recovery, much like we saw with Damar Hamlin. Here's Dr. Jennifer Ashton explaining more about this horrible situation.
Can you just please explain to all of us what exactly happens during a cardiac arrest?
So first, it's really important for people to understand this is a completely different situation than a heart attack, which then leads to someone's heart stopping. Sudden cardiac arrest, particularly in an elite athlete, can occur for a variety of reasons. We have to remember there's electrical parts of the heart and then there's structural mechanical parts. Either can cause the heart to suddenly stop beating. The most common cause is something that's actually structural and congenital, known as HCM, or hypertrophic cardiomyopathy, but we can see it with irregular heartbeats and arrhythmia. Obviously, we saw with Damar Hamlin, commotio cordis, as a result to a blow to the chest. But when the heart stops beating, the clock starts ticking, and that's because every minute that the rest of the body, the brain, the heart, the rest of the vital organs are deprived of oxygenated blood, the chances of survival go down. So again, to echo the James family spokesperson, really the credit is due to the emergency responders and the certified athletic trainers and the coaching staff on scene who was able to apparently perform early bystander CPR, possibly AED use. We know that that is critically important, as it is to activate the 911 system and get someone to a hospital.
Absolutely. Dr. Ashton, I think part of what makes this so jarring, right, is that we're talking about a healthy 18-year-old young man. How often does this happen?
Well, remember, I think part of the reason people are surprised when they hear cardiac arrest is they think heart attack. Remember, when you're talking about this population, competitive elite athletes, it is uncommon. We see about 100 to 150 cases of sudden cardiac arrest in these younger athletes in this country every year. That's obviously uncommon, but if that's your child, all it takes is one. So I think that it's important to distinguish. This is not a heart attack. This is something completely different. And again, it calls to mind just how important it is to learn bystander CPR and the use of one of those AED defibrillators.
I think the most important thing here, Dr. Ashton, is Bronny's health, his return to normalcy. You mentioned Damar Hamlin a little bit earlier. He's one of many athletes who lent his voice in support, tweeting about Bronny James, wishing him a speedy recovery and saying that he's there for you guys as they come through all of this. But can you just explain for an athlete, what does the recovery and ultimately the likelihood to return to sports look like after a patient has suffered from a cardiac arrest?
Well, first, the mental component. And I've spoken to Damar Hamlin. I've gotten the honor and privilege to get to know him a little bit. He's an incredible individual, but the psychological, mental, and emotional recovery after someone goes through this in some ways can be more significant than the physical one. Standard procedure really physically is to monitor and or manage someone in the acute period of time following an out-of-hospital cardiac arrest in an intensive care unit setting. That's to make sure that neurologically, cardiovascularly, their respiratory system, liver function, kidney function, all organ systems are secure and stable. And then, you know, they don't just get sent home from the hospital. They're monitored in an in-hospital setting. And then we have to try to figure out why the cardiac arrest happened. And that will then determine someone's return to play eligibility.
The hope for Bronny James is that he doesn't have a physical underlying condition that could have caused this. That's exactly what happened to Hank Gathers. So after he collapsed the first time, he recovered and kept playing basketball. Eventually he collapsed again, and that time it was fatal. I've also seen a lot of concern that this is a side effect from the COVID-19 vaccine. It's obviously way too early to tell, but if he wasn't bumped like Damar Hamlin and there was no pressure on his chest, then it could be myocarditis, which is an inflammation of the heart caused by a virus. And that is a known but rare side effect of the COVID-19 vaccine. It primarily affects younger males, and it's one of the reasons why we've seen an increase in these number of cases over the past few years. And this is coming directly from Pfizer. Again, it's way too early to know what happened. He might not even have myocarditis, and there's many other reasons why he could have it. There's also many other reasons why he could have went into cardiac arrest. But I think it's important to mention that this isn't a conspiracy theory. This is a known but rare side effect, but there are many other reasons why Bronny James could have collapsed on the court. The important thing is that he makes a full recovery, he doesn't have any physical issues, and he's able to get back on the court and be himself. But that's all I have for the video. Leave a like if you enjoyed it, and subscribe for more NBA content just like this, and I will see you in the next upload.